Hello, everybody. Welcome to the CAPS 2022 and to this breakout session entitled Surfacing Hidden Shame. My name is Dr. Edmund. I am a psychotherapist and researcher in private practice in Malaysia. During this presentation, you are able to enter into discussion via the chat feature. You're welcome to take advantage of this opportunity to interact with me after the presentation. That is assuming that CAPS will arrange this session in a time slot that is workable for me after my time zone conversion. So let me put on my PowerPoint and we will get started right on. Now, most of what I'll be sharing comes from this book, Shame-Informed Counseling and Psychotherapy, Eastern and Western Perspectives. Before embarking to write this book, I had spent some years doing field research on the subject of shame. And this book was published last year by Routledge as a hardcover monograph in recognition of its value, quality, and originality. And this book is carried in many university libraries like Harvard, Yale, Oxford, the University of Hong Kong, and many more. So let us begin with this question: what is shame? Now, I invite you to try and focus on this subject of shame. I would like you to write on a piece of paper or in the chat group how you would define what is shame. This is to help you to get your engine started and you get into gear so that you can flow along with whatever that will be presented on the subject of shame. Now, just take a minute or so and try and figure out how would you describe what shame is? Will you do it now? Just a simple phrase will do. Now, for many of us, you will find that it is not that easy to come up with a definition of what shame is. This is because shame is, by its nature, is very complex. You can easily describe the other emotions such as guilt or fear or anger. But for shame, it is a bit difficult to pinpoint. And we might say it's some kind of shyness or embarrassment, but these are the external manifestations of what shame is. And these are shame complexes rather than shame. So let me give you some very simple definitions of what shame is. Ellen says shame is a feeling of pervasive defectiveness. In other words, we find that it is feeling bad about who we are, the self being considered defective or inadequate. This is compared to guilt. Guilt is feeling bad for what we have done, but shame is feeling bad for who we are, referring to our core self. And Erik Erikson in the 1950s, he says, shame is rage turned against the self. Techne and others put it simply as shame is feeling bad about oneself. So this is the psychological perspective of what shame is. And what causes shame? When we fall short of our own expectation of ourselves, or what others expect of us, then there is ground for shame to arise. Sandler and others say this is the difference or the gap between the ideal self and the actual self. The ideal self is what you aspire to be. The actual self is what you found yourself as. So the bigger is this gap, the bigger is the propensity to more shame. Now, let us look a bit more into the dynamics of shame. And we want to begin at the beginning because human nature is the same, whether it is now or when men and women were first created. So at the account of the fall in Genesis 3, now Satan has already tempted Eve and she ate the forbidden food and gave it to Adam, and Adam also ate the fruit. And verse 7 said, then the eyes of both of them were open, and they realized they were naked. So they sewed fig leaves together and made coverings for themselves. Then the man and the wife heard the sound of the Lord God as he was walking in the garden in the cool of the day. And they hid from the Lord God among the trees of the garden. But the Lord God called to the man, Adam, where are you? And Adam answered, I heard you in the garden. I was afraid because I was naked, and so I hid. The question is, what's the emotion of Adam mentioned in the Bible after the fall? So to answer this, we look at verse 9 and 10. But the Lord God called to the man, where are you? He answered, I heard you in the garden, and I was afraid because I was naked. So afraid means the emotion mentioned in the Bible after the fall. Adam said he was afraid. He has the emotion of fear. But what really is the emotion that's foundationally present in because I was naked? Here he says, then the eyes of them were open and they realized they were naked. And so they sewed fig trees together and made coverings for themselves. What is the emotion that made them make coverings for themselves? Right? They must have felt a sense of shame because of the nakedness, and they saw each other's genitals. So covering up one's nakedness is the psychological hallmark of shame, according to Georges, who pinpointed right on the spot of this underlying emotion of Adam. Now let us look at the episode of Cain and Abel. In the course of time, as written in Genesis 4, Cain brought some of the fruits of the soil as an offering to the Lord. And Abel, who is the younger brother, also brought an offering, fed portions of some of the firstborn of his flock. The Lord looked with favor on Abel, the younger brother, and his offering. But on Cain and his offering, God did not look with favor. And so Cain was angry and his face was downcast. So the question again, what are the emotions of Cain as mentioned in the Bible after the offering episode? Cain was angry and Cain's face was downcast. In other words, the emotion of he felt anger and he felt sadness. And come back to the question, what would be the emotion that's fundamentally present underneath Cain's anger and sadness? On Cain and his offering, God did not look with favor. So Cain was angry and his face was downcast. So what was that made Cain to be angry and his face downcast? Having these emotions of anger and sadness? It is because his offering, God did not look with favor. Now, what happened was Cain lost face with his younger brother. As the latter did the right thing and gains God's favor, while Cain did not gain God's favor. An older brother is supposed to know better. And so Cain was ashamed of himself. And therefore, what is underneath that anger and sadness of Cain was his shame. But shame lies hidden underneath, did not surface. What it triggers off are these secondary emotions. So when we talk about the hiddenness of shame, we are saying that the effect of shame often remains hidden underneath the surface emotions triggered by it. And hence shame is not readily recognized and admitted by the person who experienced the shame. And Chef put it this way, shame is the most frequent and possibly the most important of emotions, even though it's usually invisible, hidden underneath. Now, Kaufman is more pertinent when he stated this to the American society. He said, shame is experienced by all people anywhere in the world, but in the American society, shame remains much hidden because the taboo on it is so strict that the people behave as if shame does not exist there. And Libby said this. She was more psychological in her perspective. Shame can be so painful that it is often disowned, denied, or disapproved. And hence, shame mainly occurs outside of awareness or lies hidden behind secondary emotions like anger, fear, and grief. So why shame remains underneath? Why it stays hidden? The first reason was given by Jeffrey Kaufman. This is Kauff, 2F, different from Gerson Kaufman. Now, Jeffrey says that one of these main reasons are because there is shame of shame. Right? We feel ashamed of even trying to, experience or, feel our own shame. Is it shame or shame arises out of our anxiety of being assessed less than others. And so we regulate what we reveal about ourselves to be on the safe side, to avoid risking ourselves to being shamed. So one of the main reasons why shame is not allowed to surface is because we are ashamed of our own shame. And the second reason given by Kugler and Jones, he says there's no easy remedy for shame. When we want to talk about shame, we do not know what is, we're going to say after that. The secondary emotions triggered off by shame are often those that one will readily admit and talk about than the underlying shame itself. So if shame triggers off guilt, we would rather talk about the guilt. Because in guilt, you can make amends for your guilt, right? But in shame, you don't have any easy remedy for it. If you're talking about your anger, well, you can say, oh, I want to vent my anger. I want to ventilate it, right? When you talk about sadness, right, or you're going through grief, I must process that grief. So there is an easy remedy for such emotions, right? But when you mention about shame, well, I really do not know what to do next. And there is no closure to what you are trying to experience and express to others. So these are the two main reasons, right? Shame is often disowned or, disapproved and disavowed, rather than bringing it to the surface. But why is it important to attend to the underlying shame? It is important because shame is the master emotion of everyday life. This is what Chef stated in his book, right? It is the prima or the root emotion that is experienced so often. And Kaufman was very spot on. He said, shame is the principal impediment of all relationships, whether parent-child, teacher-student, therapist-client. And if we are to understand and eventually heal what ails the self, we must consider the effects of shame. In other words, a lot of our relational problems and a lot of our psychological maladaptive behaviors, although annoying to the client or to the student or to the child, right? Many of these are rooted in the underlying shame and not those surface emotions that we manifest or we complain about. So assessing the root of the problem is very essential, right? At the same time, we have to recognize that a lot of all these problems are linked to shame, right? And Hades and Levy said that there are vast empirical evidences linking shame to many of our psychological problems. Deering and Techney also stated, empirical findings confirm the long-standing clinical literature indicating the frequent experiences of shame contributing to the individual vulnerability and our psychological distress. Therefore, since shame is the root emotion that causes many of our psychological problems, if we want to offer a more reparative remedy to people contending to these problems and not just address helping them to cope, helping them to manage, and giving them something superficial kind of treatment on the surface, right? We must ultimately trace back and attend to their underlying shame. And how do you trace back to the underlying shame? The link here is what we call the defense strategy. Now, when people come to us for counseling, for therapy, they'll, tell us what they'll complain about, their problems and all this. And these are all the presenting issues at the beginning of therapy. But unknown to the client, the underlying cause may be because of the hidden shame that is underneath. And the link between these two is what we call the defense strategy, or you can say is the defense mechanism. This is because the hidden shame, they are stored in our internalized memories, and the hidden shame is waiting to be triggered and so that it can surface. And when this happens, we will feel the unpleasantness, the pain of those shame. And to relieve this unpleasantness, the person will adopt a defense strategy, right, to press down, to suppress this feeling of shame. Unfortunately, the habitual and unconscious overuse of this defense strategy will release the psychological symptoms that mask the underlying shame. And these are those maladaptive complaints that the person who comes to us for therapy will be talking about. So a defense strategy, what it is? A defense strategy is an affect management technique adopted by a person, often unconsciously, to govern the feelings, cognitions, and behaviors as a reactive phase of this shame experience in order to lessen the effect of the shame. And the type of defense strategy that's adopted will depend much on the early child caregiver's past experiences, the inherent temperament that shapes one's personality, and the environment that that person is in. So we will want to examine more about what is this defense strategy. Now, Nathan, the late Nathan, talked about the compass of shame. And for this compass of shame, he said there are 4 typical defense strategies adopted by most people. The first one is called withdrawal. Withdrawal, you stay away so that, you minimize the risk of shame. Then self-attack. You attack your own self, right? To derogate yourself in order that you can seek the approval of others. Or you attack others. You go and shame others first before you give them the chance to shame you. This is to gain the superiority over others to avoid your own shame. And then there is this avoidance defense strategy. You want to distract yourself by some form of addiction and so on and so forth, right? You distract your focus so that, you can ignore or disavow your own shame. Now, more details on this withdrawal. The purpose of withdrawal is to become virtually invisible, silent, secretive, isolated. You're away from the scrutiny and judgment of the others. And it's both physical and psychological, right? So that you cannot be shamed or don't give them the chance to shame you. So when people come with complaints and symptoms that say, oh, I don't know why I'm so shy and I'm always very elusive, and that is why I'm suffering from so much of loneliness. I'm always People find me emotionally unavailable, or I stutter when I try to talk, and I have so much of anxiety, PSD, I'm hypersensitive to being rejected by others, right? And I find myself with very low self-esteem. I'm depressed. I always experience agoraphobia, even impotence, GTT. So all these psychological symptoms are the result of the overuse of the defense strategy of withdrawal, because you want to escape from the shame that is underneath, right? And we experience this kind of psychological issues very often in our therapy sessions. And unless you're aware that the root cause is actually the shame, both the client and the therapist may not even have an inkling that all these things, right, all these feelings and emotions and problems are rooted in the hidden shame. Now, let me give you an illustrative case that I have done in the past. These are real cases. I was once referred a very depressed student named Anne, who could not continue with her final year studies in astrophysics in an American university. That was after seeing a psychiatrist and a student counselor to help her cope with depression for 1 whole year before her father persuaded her to give up everything and come back. While attending to her depression, I also discovered that in her school days, she was constantly shamed by her teachers for not completing her homework. To avoid further exposure to shame, she has set very high expectations on herself. At the same time, she became extremely shy, even to the extent of avoiding to ask questions on what she did not know. Unfortunately, she came to a breaking point in her final year when she could not catch up with her studies and her mind went totally blank. Besides addressing her depression with cognitive behavioral therapy techniques, I also attended to her shame, freed her from her withdrawal, and helped her to regain her confidence. She eventually recovered from her depression, went back to her course, and successfully graduated from it. Now, the defense strategy of self-attack. The purpose is to engage in the intentional derogation or the putting down of the self and being differential, compliant, submissive to others in order to gain their approval, to avoid the fear of abandonment or deaden the inadequate self, to annihilate the shame within. And the presenting issues, the symptoms, you can see in the false modesty, the self-neglect, the self-humiliation, even the self-injury, self-sabotage, obsessive compulsive behaviors, masochism, bulimia, anorexia, people who refuse medication, and even having suicidal ideation. Now, these are all the external manifestations of the overuse of the self-attack defense mechanism or defense strategy. So another case, as an illustration, and this is on obsessive compulsive disorder. I once treated a client named Patty who compulsively washed her hands many times after going to the toilet or bathroom. I initially tried using exposure and response prevention techniques on her, but this only helped her to cope superficially with her compulsive behavior without getting to the root of the problem. I eventually learned that when she was a child, she perceived that her father molested her, and she grew up ashamed of her dirtiness. Whenever she touched her underwear, she would feel dirty, and so she constantly washed her hands to get rid of the dirtiness as a form of self-punishment. To bring about the structural change at her level of her core beliefs and early memories, I attended to her shame by bringing her back to the original incident of the sexual abuse, led her through an emotional reframing experience, and then delivered her from her shame and her compulsive behavior. Next is defense strategy of attack other. The purpose of this strategy is that by projecting one's shame onto others and shaming them through becoming aggressive, to overpower them, and to elicit superiority so as to escape one's own shame. I said before, this strategy is you want to shame others first before they have the chance to shame you. And if you find people, who are always humiliating others and putting down others, they are bullies, and they always go into rage and always sarcastic and hostile, intimidate others, and they're violent, they are murderers, they are always in abusive relationships, and into domestic and sexual abuse, vandalize around them, and they even have antisocial behaviors, and they are even murderous, as said before. So these are all the behaviors that are typical of the overuse, the habitual overuse of the attack other defense strategy. And let me give you another case. I once counseled a couple of which the wife, Cindy, was often abused physically by her husband, Norman. Couple therapy techniques like reframing, reappraisal, and empathy-based collaborative alliances, as well as anger management strategies, had made some, but only limited difference to the ongoing violence. So after some time, I began to focus on the man's shame. I found out that as a child, his parents used to shame him for not doing as well as his younger sister in their studies. He grew up with a high sense of inferiority towards younger women. And each time he felt insulted or disrespected, whether in the family or at work, he would take it on his younger wife. I gave him the insight of what made him attack others as a defense strategy against his own shame, and help him to embrace the truth that his self-worth is not based on how other people see him, but on what he is as a unique individual who is no less than anybody else. And so after the intervention on shame, their marriage has improved remarkably without further serious incidences of domestic violence. The last defense strategy is avoidance. The purpose of avoidance is to seek to distract oneself or redirect one's focus through activities, through enhanced body image, through possessions, through competency. And the purpose here is to really to cover the defective self in an effort to disown or disavow the unbearable feelings of shame within. So I'm sure you have come across people, who are overly narcissistic, very grandiose, or they are addicted to alcohol, to sex, addicted to drugs, addicted to exercise, addicted to food. Or these are all the ways that they try to distract themselves, right? To redirect their focus. Or they have insatiable wealth accumulation and always spending, consumer spending, or they are always exhibitionistic, and even those who are religiously mystical, and those who are always seeking for thrill, right? They take a lot of risk in their behaviors. They are very perfectionistic. They're focused in getting something perfect, right? Or they're always lying pathologically and complaining about inner emptiness. Now, these are the external manifestations through the overuse of the avoidance defense strategy, because there is so much of shame underneath them. So one last case, Alex was brought to me for counseling by his wife as he was addicted to gambling, and the family was on the verge of breaking up. I initially utilized the normal evidence-based intervention protocols, which include cognitive restructuring and financial time management training, as well as the imaginal desensitization techniques. Alex eventually stopped his gambling activities, but he complained that he has to exercise a lot of effort, a lot of willpower in order to manage his urges, suppressing them down. And he said, can you help me to set me free more completely? I explained to Alex that ultimately his addiction is a form of escape and distraction from his overwhelming sense of shame built up since his childhood days. It is a substitute for relationships and a way to avoid intimacy and closeness due to his lack of relational worth. Alex then revealed that when he was young, he constantly experienced a lot of shame as he was placed by his widowed mother under the care of a domestic maid who had often rejected and abandoned him. And so after the supplementary intervention on shame, Alex reported that he has sensed that he had this genuine breakthrough from his gambling urges, because we got down to the root of his problem. And linking the symptoms to this hidden shame, right? Because the counselee has no inkling that all these undesired behaviors are rooted to the shame within him or within her. So we have to educate the counselee that the manifested symptoms are caused by the hidden shame through the overuse of certain defense strategies. And that is the first important step. With this insight, the counselee will be more open to work with the therapist to surface that hidden shame. And surfacing the hidden shame will pave the way for the counselee to trace back to the original trauma that congregated that shame, so that we can address the hidden shame as the next part of our therapy. And to explain how we surface that hidden shame, I refer back to one minor study that I have done last year. In addition to my several years of study on shame prior to writing my book. Now, this minor study involved conducting one-time focused conversations with a sample of Malaysian women of Chinese background following their perinatal losses, such as miscarriage, in the last 3 years or less. Now, I must explain to you that Chinese societies traditionally expect women who have suffered a perinatal loss to feel loss of faith, to feel some sense of shame. This is for failing to give birth when other women had succeeded in doing so. Now, the Chinese communities, they are very collective, very communal, right? So this is different from the West. This is different because Western cultures, a perinatal loss would not be perceived as something shameful. It would be perceived as the biological loss of a child during pregnancy. That has nothing to do with the competency of the mother. And therefore, there is nothing to be ashamed of. But we are talking about societies in the East where the cultural values and expectations and norms are different, right? And this is where shame can arise. And the instrument used to measure the internalized shame is called the internalized shame scale. This is developed by Cook. This involves self-report questionnaires, 24 negatively worded items to be answered by the participant. So the lowest ISS score on shame is 0, the highest is 96. And anything that is 50 and above, right? It can be either frequent experience of shame or high shame. So once your score touches 50, that means that is a high sense of shame. And the reliability analysis of the ISS questionnaire used in my survey demonstrated a very strong internal consistency for shame in my current sample, almost close to 1. And this is the result, the outcome of the study. You find that in the last column, most of the participants have scores that are 50 and above, right? Although very few of them initially admitted feeling any shame. So 7 out of the 10 participants have significant levels of shame, meaning their scores are above 50. And 9 out of 10 did not initially express feeling any shame. They say, you know, there's no sense of shame after following their loss. Only 2 of the 7 participants with high shame scores admitted to feeling some shame, but this is in the later part of the conversation, not at the beginning. And let me give you the narrative of 2 of them. One is a nurse. She said, although I experienced sadness, anger, and even fear, there wasn't any sense of shame. However, when she was asked if there's any incident when she particularly felt very bad about her loss, she started to pour out her frustrations more openly. She said, a couple of my hospital colleagues asked me, what's wrong with you? Another advised me, why not go and see a specialist to check if there's something wrong with you? And she protested, there is nothing wrong with me physically. I'm not sick, except that I lost my child through a miscarriage. But I'm no longer the same person I was, and this is the admission. I felt like a failure. Am I so weak and worthless? Yes, there was disgrace and a sense of shame in me. The second narrative is that of a lawyer. She initially spoke at length only about her guilt and anxiety. That's the beginning part of the interview. As the conversation continued, she related an incident in the office where one of her clients asked her why she was not working the last 3 weeks. So the lawyer narrated to the researcher. She actually told her client a lie, that she was away traveling overseas. And then she said, I felt so bad for telling my client such a blatant lie. On reflection, it is the shame in me that I tried to cover up the miscarriage. I felt unworthy as a person. I felt like a failure. Now this is the language of shame, and hidden shame surfacing to be expressed. And so, why is it easier in what situation is it easier for the hidden shame to surface? Shame has a social nature connected to our human need for belonging and be included as part of a social group. When our secure social bond is threatened, as in the case of the nurse's anxiety of being assessed less than her colleagues, or the lawyer's fear of rejection by her client for lying to her, then shame is evoked within those social contexts as they are being narrated. And this takes place whether it involves an actual interpersonal interaction or merely a perceived one when we are talking about it to another person. So thus, hidden shame is more readily accessed by awareness and emitted when our attention is directed at the social context involving some interpersonal interactions, whether real or imagined. And therefore, if we are to, our intentions is to surface that hidden shame, and we are exploring with our client during the therapy session. Now, this is an example of an exploration with Adam as the counselor. So you might ask Adam, please tell me more about why you want to hide from God. You see, you bring in the hiding from God because this is the social context of Adam's interpersonal interaction, right? Then as you explore further, you can say, apart from your fear, what other emotion you think you want to hide from God, that made you want to hide from God? So again, you bring in that social context when you explore with Adam. Or when you explore with Cain, right? You ask Cain, please tell me why you want to murder Abel. See, Cain, Abel, and there is this social context. You say the reason you wanted to murder Abel was because of your anger, your sadness, so unbearable to you. So apart from your anger and sadness, what other emotion you think made you want to murder Abel? So you see, that is this social context that you want your client to bring in and start to talk about it. Because as you talk about this in the social context, he can get in touch more easily with what is his underlying shame in order, to allow it to surface. And this is something that we must be aware of when we want to help the counselee, right, to bring their hidden shame to the surface. And as an application, even in our psychometric measurement of shame, right, we can rephrase our questions. For example, question 1 of ISS, it says, I feel like I'm never good enough. From this statement, they want you to rate whether you are 0 or you are 1 or 3 or 4. How true is this statement? So you can rephrase this question, and put in the social context for the participant to get into this context. It can be rephrased like, if I'm in a class where the teacher asks for a volunteer to present a piece of homework given to all students, I often don't volunteer because I feel I'm never good enough. So instead of just that statement, right, you put in the social context, and this will help us to get in touch with the shame within, right? And hopefully, as this is being incorporated, we will get a more accurate measurement of the shame within us. And this is all that I want to present to you. And I would end with referring you certain books and articles that you can read for yourself. I've mentioned about Alan. He wrote on trauma, but at the same time, he also mentioned about shame. And Cook is the one who came up with the ISS scale. Daring and Tanning, they are very established researchers and writers on the subject of shame. And this is Eric Erikson. He mentioned about shame under the book, in the book Childhood and Society. Georges is a Christian writer, writing on honor shame. And we have Kaufman. His book, Psychology of Shame, is one of the classics in the knowledge of shame. And Netterson, his article on the compass of shame is often is very well quoted. And of course, my book on shame-informed counseling and psychotherapy. So Chef is also very well known in the area of shame. All right, I hope you have benefited somewhat from this presentation on surfacing hidden shame, and I hope that you when you do your therapy, you are aware that many of the causes of those psychological symptoms that are presented to you can be rooted in the hidden shame. And so it is necessary for you to surface that root cause of the hidden shame. Thank you.